everybody. This is me, Amin.
And this is Alex.
And welcome to another episode of Let's Talk About. And in this episode, our ongoing coverage of the COVID-19 situation in Malaysia. In today's episode, we're going to cover specifically about vaccination. So before we start, just a reminder, it's the Thursday, 5th of August today, the day that we shoot. So sometimes things get updated, sometimes things change, our perspective change because new things happen after we publish this show. So this show usually takes about a week to go on YouTube. So there might be some changes. Just some fair warning to you guys. So again, this is now the Thursday, 5th of August that we're shooting this show. All right. What's been happening? Previously, during the start of the national immunization program, the government set a target of 80% of the country's population to be fully vaccinated by the end of this year. When we first heard about this, we were quite skeptical because the start of the vaccination program was slow. We were slow off the line. Our vaccination numbers in terms of the daily doses administered were quite bad at the beginning. The first, I think, couple of months, we were barely hitting 100,000. We were hitting like 10,000, 20,000 doses a day. But things have been ramping up. They've been ramping up consistently. We saw doses increase from 200,000 to 300,000 to 400,000, and we hit like a record number of 500,000 doses administered within a day. That is an astonishing number by any measure. In fact, we are one of the fastest countries to be able to vaccinate people, even if you compare to developed nations, and that's a good thing. We mentioned also in our in a number of our previous episodes covering the COVID vaccination situation in the country that Malaysia is on track, that we are going to be able to hit 80% of the country's population by the end of this year. We are going to be able to hit 100% of adults in the Klang Valley to have at least one dose by the 1st of August. Yes, that we've hit that milestone. It is the 5th of August now. But that is because of the help of this Operation Surge that Khairi mentioned, I think, a few weeks back. The concerning thing that we're seeing now is that the vaccination numbers are kind of stagnant, or they're kind of like going down. We've not been able to hit 500,000 doses in a day for, I think, about a week already.
Since 2nd August.
And also, looking into the numbers, newsflash, 80% of the country's population also includes people below 18 years old and below. That means if we focus only at 18 years old and above, we're not going to be able to hit 80% of the country's population by the end of this year. We're probably going to hit, 75%?
At most 75%, the minimum 70%. But that's haven't taken into consideration people who can't get vaccinated or people who refuse to get vaccinated.
Yep. Okay, so we are in a situation right now. Are we going to be able to hit 80% of the country's population by the end of this year? What do we need to do because the Prime Minister has mentioned that the government is considering to loosen restrictions for those who have been vaccinated. I think he said that like a couple of weeks ago or over a month ago. And after that, nothing has happened. The politicians are too busy politicking. I think it was yesterday that he made a shocking, not a shocking announcement, but he made like a Facebook Live or whatever it was. He did like a press conference to say that he's still the Prime Minister, whatever. To be honest, I think we're all sick of this. Again, I just want to remind everybody, we're not a political website or platform. We're not involving anything political here, but on both sides, opposition and also the current government, I think I speak for all Malaysians that we're sick. We're sick and tired of this. So the question now is, what do we need to do to hit 80% of the country's population? And what is the threshold that is required for us to at least open up? Right? The government has not said what is the threshold. we don't know what vaccination phase that we're in. So previously, when JKJV started the vaccination program, there were phases. There was phase 1, phase 2, phase 3 that will take us all the way to the end of the year. And then suddenly there is now phase 4 and phase 5, which we have not heard of. So phase 5, if I'm not mistaken, is to start vaccinating the 18-year-old and below. And
Below
if you
18
recall,
years old.
yeah, the 18 years old and below. If you recall, that is the crucial 5% to get 80% of the population, of the country's population vaccinated. Why 80%? It is to get the herd immunity going. So, what do we do? I mean, it doesn't seem like we have a plan already now. It doesn't feel like, I don't know, I think everybody's just tired. So what's going on, Alex?
Okay, so I think first things first is that looking at the COVID situation right now is very worrying. As of today, we've hit the 20,000 mark for the first time ever. We reported more than 20,000 cases. So it's very worrying. And like how people are concerned is that how are we getting so many cases in the Klang Valley when there's a lot of people being vaccinated? So that's one issue. And then the second issue is that, the government is talking about opening up the economy to loosen restrictions. But if looking at the current situation and looking at the original plan by the government, because Muhyiddin announced the National Recovery Plan, remember that? There's like 3 criteria. So the first criteria is the vaccination rate. To reach phase 3, which opens up more social activities, more economic sectors, we need to hit 40% of the population being fully vaccinated. I think we are close to hitting that because as of recording right now, we have about 45% of population getting 1 dose, and then 23.6% getting 2 doses. So I think by end of this month, we should be able to hit that target if we maintain the high vaccination rate. And the second criteria would be the ICU condition. And we mentioned this before. The number of cases isn't something that we should focus on. We should focus on the medical healthcare system. ICU cases are still high. We still have 1,000 over cases in ICU. It's increasing by the day. A lot of people requiring ventilators. We're still hearing stories about hospitals being overloaded. And then the one of the criteria of the National Recovery Plan is that we must have less than 2,000 cases per day. So now we have 10 times more. So how does it justify the country to move to phase 3, to open up more sectors when 2 out of 3 indicators are not being met? So going to the high numbers of cases, right? If you look into the actual data from the Ministry of Health, which they have shown that about 80% of the cases are actually from unvaccinated people. So that shows that if we have more vaccinated people, we should be able to reduce the hospitalization. But until today, it's still very high. If you look at today's breakdown, I would say that Klang Valley still contributes more than 10,000 cases. So does vaccination work in preventing hospitalization and death? If you look in Klang Valley, although the vaccination rates are high, but you should look into the granular data, which the Ministry of Health doesn't provide. Because when they say people who are vaccinated, who has vaccination history, about 20% of them got infected, but we don't know what kind of status are they in right now. Because being vaccinated could be a few reasons, few things. Number one, you could be vaccinated with just 1 dose. 1 dose is not enough, especially for the Delta variant. To be fully vaccinated, you need to be vaccinated and have a 2-week window. So after 2 weeks, after you complete the vaccination with 2 doses, only then you have the full optimal protection.
Coverage, yeah.
The coverage, yeah. And as we know, the JKJV, kudos to them for accelerating the vaccinations in the Klang Valley. We are close to 100% of adults in the Klang Valley having 1 dose. But that's not enough. But if assuming that most of them have Pfizer and Sinovac, I would say that most of them will be fully vaccinated by the end of August. And KJ has said that his aim is to have 50% of the adult population being fully vaccinated by Merdeka Day. So is it safe to open up the economy? That's the next question, right? Because vaccination, is it enough to open up the economy? Well, if you look at Sarawak, which has one of the highest vaccination rates in the country, as of 4th of August, Sarawak has vaccinated 61.9% of the population with 1 dose, and half the population have already completed their vaccinations.
Nice.
And if we look at the number of deaths, right? So the past few days we've been getting a lot of high record number of deaths, like 200 over deaths per day. Even yesterday, we hit a record high of 257 deaths. And guess what? Sarawak is not on the list. Sarawak has not been recording any deaths during 2nd of August. Let me just check through again. Yeah, Sarawak has not recorded a single death on 1st August, 2nd August, and 4th of August. On 3rd August, they only recorded 2 deaths. And yes, the cases are still quite high. I think they have recorded like 400 cases of COVID, but deaths are low. So that shows that the vaccines are working. So I would say that for people who are still worrying about does the vaccine work, I would say that we need to wait until the end of the month or at least early September to see the real effects of the vaccine. Because like I mentioned, you're only fully vaccinated 2 weeks after receiving the second dose.
Okay, well, I don't know. Is it good news or bad news? Yes, Sarawak is an indicator. I'm not sure whether the demographics and the population spread of Sarawak is similar to what it is in Klang Valley. Definitely, it is not. I think people are more spread out, and I
Less
guess
dense.
that contributes to the number of cases. In Selangor and Kuala Lumpur, for example, I think the population density is much higher. I don't have the numbers, but the thing that's baffling me is, despite everybody staying at home and social distancing, the number of cases are increasing. And I mean, it seems like counterintuitive, right? So the number of cases are increasing, the number of deaths are increasing, yet the number of vaccination is increasing as well. Vaccination rate is increasing as well. What is going on?
I would say that this all depends on the number of fully vaccinated people. So in terms of fully vaccinated people, we're still far out. So out of 6.1 million adults in the Klang Valley, only 2.6 million people have completed the vaccination with 2 doses. So I believe that once we hit at least 50% fully vaccinated, they can see the trend going down. And I think even if you look at the Ministry of Health's R0 rating, in terms of infectivity rate, I think Selangor has been going down as well. But like you rightly pointed out, Selangor and KL are different cases because, like, number one, I think we have most industries in Selangor. And we mentioned in the previous episode that while most of us are staying at home, a lot of businesses, a lot of industries are still allowed to operate. And we all know that if you're working in a factory line, it's hard to social distance. And, it's not surprising that there will be new clusters coming out from workplace. And we've seen before, despite most of the cases are considered as sporadic, which means that you can't identify where they're from.
It's not.
But it's not. I mean, look at the clusters that's identified.
Yep.
Majority of them, at least half of the clusters identified on a daily basis, are workplace related.
Okay, so let's get this straight. Number of positive cases, that number, 20,000, 30,000, 40,000, whatever thousand it is, throw it out the window. It's not important anymore. We have to look at the granular data right now, right? And as much as the JKJAV is evolving their plans and adapting their plans to cater for more PPVs, to cater for the availability of vaccine doses in the country, I think the Minister of Health need to update the way that they look at data as well. I'm not sure why there is still this focus on the number of active cases. I think both of us agree, Alex and I, that the number of not active cases, the number of daily cases means nothing anymore nowadays. Because you have to take into account there are people who have been vaccinated. You have to take into account that that number is not going to go into the numbers that we hope for. It's not going to go to below 2,000. I mean, not anytime soon, in any case. That won't magically disappear overnight. What we need to look at is vaccination numbers. And yes, I think the JKJV has been providing more clear vaccination numbers. But it seems to me that the window and the milestones have been changing. Some have been brought forward. Some have been pushed back. And crucially, There has not been any mention after My Sejahtera opening up for registration for those who are below 18 years old and below. There has not been mention of like, okay, we are ready now to vaccinate the 18-year-olds and below. I mean, why are we? Walk-ins are available now. That's great, but I think it's only in the Klang Valley, right?
Yeah, only for Klang Valley. And KJ has announced recently that to vaccinate the remaining senior citizens, he said at every state level, they're allowed to start their own walk-ins when they're ready. I mean, they can announce their own dates and PPVs that can support walk-ins in the respective states. So the federal authority has given the state the authority to launch their own walk-ins for senior citizens. So that's great. But then again, going back to the PPVs, right? So the last few weeks, we see record number of vaccinations, 500,000 per day. And I would say those are the result of the mega PPVs in the Klang Valley. That's great. So Malaysia, I think we are nearly done. Almost half of them got 1 dose. I think the remaining people, unless you're taking AstraZeneca, you're going to get your second dose by end of August. That's a given. But now what's more crucially important are the states outside the Klang Valley, because their vaccination rates are very low. And as mentioned by one of our frequent contributors, Dr. Amar Singh, he said that there are 5 other states who are having very bad COVID-19 situation. They are deteriorating rapidly. States such as Sabah, Kedah, Perak, Johor, and Penang. Because those states, right, they're having a surge of new cases. I would say at least 3, they have been reporting more than 1,000 cases consistently, like Sabah, Perak, and Johor. And the vaccination rates are very low. So we need to ramp up vaccination rates on those states. And I haven't seen any updates yet. Maybe KJ will announce something soon. But vaccination is very important for these states. Because if you look at, like you mentioned earlier in the show, we have been not hitting the 500,000 doses per day for almost a week right now. And we need to have another operational surge capacity as soon as possible in more states. We need to mobilize more resources to the states that need it the most.
Yes, and while I don't know, while cases are sporadic and while people are still, people who are, well, the administration is still, I wouldn't say clueless, I think that's a strong word, but they are still kind of like trying to adapt and learn on how to cope with the COVID-19 situation, both in terms of handling cases and also in terms of getting people vaccinated. I don't think it's prudent for the government or for KJ to say that, it's up to the states to decide when people can start walking in. Because if left unchecked, these 5 states that you mentioned, situation can get out of control really quickly. There should be like a clear guideline. I mean, we only have 14 states. Malaysia is not a big population. It's very easy to manage the situation as from a central capacity rather than handing it over to the states. Because as you know, some states, they might be lucky, like Sarawak, or they might be super good, or they might be both, and some states might not just care. I don't know what the situation is in Johor. Without the background check, I'm not sure whether these triggers in the surge of cases are a result of states laxing their restrictions or not being diligent enough like they are in the Klang Valley. There could be a number of factors, and that is the more reason why this should be centralized as much as possible. I want to come back to school children, for example. Again, I have 4 kids, and we've wasted almost 2 years of not going to school, and this is a crucial year crucial development years for all these young students, and it is also crucial for the university students, crucial for the whole ecosystem and for the whole industry. While the phases are fluid now, because phase 1 and phase 2, phase 3, phase 4 all are like a blur to me, it doesn't mean anything anymore. There are areas where we can identify, okay, right, we can open schools now, we can get schools to be vaccinated. Or not open schools, but get children to come to school and get them vaccinated there. I mean, it's been done before with BCG and stuff like that. Why the need to register? Don't we have a central registration called our IC already? It seems maybe, okay, to the layperson, these questions are up there because it was like, why are you putting all these layers in place when it's crucial that we need to start getting more and more people vaccinated, especially people who are outside of the Klang Valley? What's going on?
Yeah, I agree with you. Like for school children, right? Why do you need them to register in MySejahtera when we can do the vaccination in the school itself? And I believe, like you said, we don't BCG, right? It should be done at school level. So the JKJV can just talk to school. How many students do you have? And then we can get them registered in the school itself. Why do we need to create a separate system or get parents to register as dependent? So that one, I agree with you. It doesn't make any sense. I mean, we can just use a try and try system of doing the school registration. But the reason why we're not vaccinating school children yet is because of the concerns. It's a health concern to school children, because recently it's discovered that Pfizer vaccine, which is currently the only vaccine in Malaysia that's been given the green light by the National Pharmaceutical Regulatory Agency for children below 18 years old, it's been put on hold because there's concern that it can cause some heart inflammation, like swollen heart. There's some concerns about that, so that's why they're putting a pause onto the children vaccination for now. Because initially, I think they announced that, we're going to vaccinate the exam school children first, like SPM, STPM students. And after that, we're going to vaccinate the rest of the kids. But now they put on hold because of that. So we still don't have a clear picture when will this be resolved. Because other countries, like for example, the UK and the US, they've been vaccinating school children. I mean, teenagers. But we're not doing that yet. So I wouldn't say that there's something that we can do much right now unless the NPRA is like on the health authority is saying that okay, you know what, we studied the data and it's shown that it's not a concern for children. Then we can start vaccinating kids. But for now, it's on hold. So I don't know how to answer that. So it really depends on the safety level and how we're confident that this will not cause any health issues for children.
It just, I don't know. It just feels like it feels to me like there's more that can be done. Some of the decision making is not consistent, and I'm very sensitive towards saying all these words because I don't want to offend anybody, and I don't want to offend the JKGAV and the frontliners and the people who are working really hard administering all these doses, because I understand how tiring and how exhausting this can be, and I understand how it feels like, or at least I can empathize. But it feels like to me also the decision making is not consistent. Number one, that decentralization doesn't feel right to me. Number two, focusing on states that need help the most. I don't know whether it's been done, but if it was, it hasn't been said or it wasn't made clear. Like these 5 critical states, there's no announcement that we're going to ramp up, we're going to do Operation Surge plus 5 to make sure that these states are okay. It's not been done. So, what was our original question when we started this? Where are we now? Whether we're going to be able to hit 80% of the country's population. Okay, we've established that we're not going to be able to unless we start vaccinating people who are 18 years old and below.
Yep.
The government has announced that they're going to open up. They've mentioned this at least 2 weeks ago, but there has not been clear indication.
Yep.
At least at the time of our recording, and it's getting frustrating because what is the holdup? Am I simplifying things to say that, hey, you know what, the indications are clear, you already know what you need to do, why not just make it happen? If Sarawak is a model state, why not start there and figure out if that's the way to go? I wanted to ask why the focus is on Klang Valley. I guess it's obvious. Klang Valley is the most developed state in the country with the most factories and the most people. It's like the economy is driven here. So I just want answers. I'm sorry, guys. The guys who are watching the show, who are listening to the show. As much as because I've been reading a lot of the comments, and I've been reading a lot about what's going on out there on social media, and I've been trying to relate all the questions that you guys are asking to the shows that we cover, and trying to provide as much answers or as much indication as possible to an answer. And the more we go into this, there are good things like the number of people getting vaccination doses, but the more I look into it, the more questions I have. I was optimistic that we will see things opening up in August because of the number of people getting vaccinated. I guess I don't see that now. I guess I'm looking at Merdeka Day would be like a milestone, right? So KG has mentioned that Merdeka Day will be a milestone. So I don't know whether the government has something special in store, but I'm not hopeful as well because if you look at yesterday's announcement, where the Prime Minister said that he's still the Prime Minister, he has the backing of the majority in Parliament, blah 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 blah, and he has those people behind him. You don't see a number of crucial people there.
Yeah, and also to add on to that, right? Like the recent Parliament session, which is a bit of a embarrassment. They didn't take the opportunity to address the COVID-19 situation. We've been hitting like 15,000, 17,000 cases per day. That should be the opportunity to solve the COVID issue. And that's not been done. And it's such a disappointment. And now we're entering 20,000. Who knows, we can enter 30,000 or more. And we're not seeing any solution from the government. And that's worrying. And instead of focusing on the COVID situation, they're all busy, covering themselves.
Yeah.
Politicking. Yeah, that's right. And yeah.
Go ahead.
And like as far as Klang Valley is concerned, I would say that I'm optimistic that we'll probably see some progress in the next 2 weeks, because then again, in terms of COVID, right, everything we see right now is 2 weeks late. So the recent rise we see right now, I would say, is mostly contributed to people who travel interstate. Remember, whoever go balik kampung during the holiday season, you know who you are. So it's mainly driven by that in other states. That's why you see some states are having high number of cases. It's because of that. So that's 2 weeks late. So with a high vaccination rates, if we can fully vaccinate most adults in the Klang Valley, I would say that the number of deaths should go down in Klang Valley. But on the flip side, the greatest concern is the other states who are also experiencing a surge of cases, and they probably won't have as good as a medical healthcare system and resources as the Klang Valley. So that's the biggest worry. So like we said, we need to have another operation surge capacity in the other secondary states who are really desperately need to ramp up their vaccinations.
Yes, and I wanted to say the reason why I brought the parliament issue up is because it now will become even more challenging, because the people who are supposed to look at administering the government and also look at healthcare and also look at the COVID vaccination program, it seems to me, at least optically, or at least what has been mentioned in the public, post the announcement yesterday, that they are not unified. And that's even more of a concern because, and it seems to me that the priority here is to stay in power and to continue politicking, and if push comes to shove, if the priority is to save yourself or to save themselves and make sure that they still have a seat in parliament and still have power, they are going to compromise on the push to make this happen. So I'm not sure whether the administration, both the opposition and the current government, is unified enough to follow this through all the way to the end. And that's my biggest concern. Okay.
So what can we do to keep ourselves safe?
Vaccinate, stay at home. I don't know for how long more. I mean, I sound like a broken record, right? I don't know whether you guys noticed this, like, from this a few shows back, I'm very optimistic. Like, okay, stay safe, stay at home, social distance, wear a mask, sanitize, get vaccinated. The thing is, I think everybody is doing that already. Yet the number of cases are increasing, and the situation doesn't feel. I don't know if the numbers are getting better. KJ, whoever, please show us the numbers are getting better. But at least to me, and I don't know about you guys, if you feel the same, put them in the comment section, give us a like. If you feel the same, let us know. At least to me, it doesn't feel like the situation is getting better. Okay, and that's pretty much it. That's the cue for me to remind you that we are available on podcast. So if you prefer to listen to us while you are at home and doing your vacuuming or cleaning or exercising, we're available on podcast. So just search for Sorry Chin Chow, Let's Talk About. And we're available on all of your favorite podcast platforms. If you are listening to us on podcast, please do give us a 5-star rating if you like the show, because that helps this show. The show get more listeners. If you're watching us on YouTube, do give us a thumbs up if you like the show. And don't forget to subscribe to our channel if you haven't already. And as always, comments, feedback, suggestions, those are the most important things to us. It makes us do better shows, do better content, and we love reading and understanding what you guys think. So please drop them in the comment section below. Alright, okay, so that's pretty much it. This is me, Amin.
And this Alex.
Stay safe, everybody, and take care. Catch you guys later. Bye.
Bye.